right, go.
Good evening, my name is Gladys Brimah, and this afternoon I will be presenting my senior project on prevention of catheter infection among hemodialysis patients. Okay, the purpose of this project is to bring awareness and to prevent catheter-related infections, bloodstream infections, exit site infections, and tunnel catheter infections among hemodialysis patients. Hemodialysis patients with a catheter have a 2 out of 3 increased risk for hospitalization of infection and death compared to patients with arteriovenous fistula or graft. And through evidence-based practice, educating both the patient and staff using sterile technique and using the Bono method to reduce the number of infection among hemodialysis patients. Okay, so we have a hemodialysis machine here and a patient receiving dialysis. We have the hemodialysis catheter has 2 ports. One is red, the other one is blue. But of course those lines, they're both red, so because the blood is in there, but there's ports on there that lets us know which one is red, which one is blue. The red is the arterial. It takes the blood away from the body to the machine, and what we call is the artificial kidney that's over here to this side. This is the artificial kidney, and after it goes to there, the blood is filtered and it returns to the patient the clean blood. Okay, so hemodialysis is a treatment that used for patients that has kidney failure. And in order for them to receive this procedure, they have to have a dialysis access. And so they'll either have a hemodialysis access or a vascular access. In either case, this is a way for the blood to reach, this is a way for the blood to leave the patient and reach the dialysis machine for the dialysis procedure. The catheter used for hemodialysis is called a tunnel catheter because it's tunnel under the skin. Catheters have, okay, let's move to the next one. Okay, so the objective here, the aim for this project is to educate both the patient and the staff on techniques and methods on how to prevent infections in patients with hemodialysis catheters. My goal is that all the healthcare professionals caring for hemodialysis patients have a greater understanding of the need to prevent infection among these patients. Again, this project topic was chosen based on a need for patient safety, to bring awareness, to teach the staff different methods and techniques on how to prevent infection among these patients. Okay, so my PICO question is, in dialysis patients with a tunnel catheter infection, how does using the antibiotic lock compared to using a sterile technique affect the growth of bacteria? Okay, what is infection? What is a catheter infection? Catheter-related bloodstream infection is defined by the presence of a bacteremia originating from an intravenous catheter. It is one of the most frequent lethal and costly complications of centrovenous catheterizations and also the most common cause of nosocomial bacteria. Okay, so catheter infections result in bacterial infection, fungal infection, and viral and parasitic infections. Okay, so this slide here is basically telling us that Um, gram negative and gram positive bacteria are highest among causing catheter infections. Candidus has about a 16% rate, and the last one is basically the organisms that lives on the usual organism that lives on the floor of our skin, and that's usually streptococcus.
I have a question. What is the Candida? What type of infection is that?
Candidus is a fungal infection,
Okay.
and is one that you usually you think of when women have yeast infection.
Okay.
All right. Okay, so this slide is showing you a picture of a non-tunnel and a tunnel catheter. The non-tunnel catheter is always in the jugular. It's not always in the jugular. It's either in the jugular or the femoral. But the most desirable place for non-tunnel catheter is the IJ, which is the interjugular. The tunnel catheter is always going to lay on the chest, as you see it there, and it is tunnel. It's tunneled up there to the IJ as well, but it lays on the chest opposed to having the rabbit ear sticking out of the neck.
I have a question.
Yeah.
Why is the catheter always going to be in the jugular or in that specific area?
Okay, so the non-tunnel catheter that's in the jugular, well, it's always going to be it's always in the jugular because that's just that's the vein that's is the most desirable for these type of catheters.
Okay.
Okay, so catheter infections results in, and these are just other complications that can happen if the catheter, if the infection is not caught in a timely manner. You can end up with septic arthritis, endocarditis, brain abscesses, orthomyelitis, sepsis, pulmonary emboli, and spinal epidural abscess. Okay, so here we have a catheter, a picture of, this is what we call an exit site infection, and I know that because of the way it's discolored around the skin. And this picture here is representing a tunnel catheter infection. I mean, if you look closely, you can see the white mucus coming out from around the tunnel of the catheter there. So that's the difference between an exit site and a tunnel catheter infection.
I have a question. And it's infected because of hygiene, hands not being clean, skin not being clean?
Well, it could be from a number of things, but we won't know what type of infection it is until we do what we call blood cultures, or maybe like this one, swab that exit site there for that mucus coming out of there. But I can't say exactly what caused it, because it could have been caused by a number of things. It could have been caused when the patient was getting the catheter put in. The catheter could have been damaged coming from the manufacturer. Could have been non-sterile techniques used when changing the dressing, so it could have been.
Okay.
Okay, this picture is just illustrating how the catheter, you have your skin, the layer of the skin there, and how the catheter is tunneled under the skin, so it gives you an idea of how the bacteria would travel from the skin to the catheter. Okay, so why and how does catheter infection happen in a dialysis setting? Okay, as I said before, with the question you asked, there are several or many reasons why infection could happen. Like I said, it could be the condition of the catheter when it was being manufactured. It could have been contaminated during the procedure. It could be where the catheter was placed. Then there's 3 different places that they usually put the catheters. They usually put one in the jugular. You'll either see it in the jugular, you'll see it in the subclavian, which is in the chest, or in the femoral. So, but the most desirable place is in the jugular, and the least desirable place is in the femoral, because in the crease of it's in the crease of between the stomach and your thigh, and it's a fold. So bacteria like to grow in warm, moist places. So that would be a place that they will try to avoid if possible. Okay. Also, the duration of the how long the catheter stay in place plays a factor in how if the catheter get infected. These catheters are mainly used for an emergency. So if the patient came in and they was in renal failure but didn't have no idea prior to, then a vas cath or either perm cath would be put in place. But the length of time for a vas cath should be between 1 and 3 weeks. And for a perm cath, I believe it could stay in greater than 3 weeks, but the least amount of time that the catheter stay in, the decreases the chances of infection. Okay, prevention of infection. This slide here just kind of give you an overview of some of the things that I've already said. If you suspect your patient has an infection, some of the things that after you notify the physician, he'll want you to do is draw some blood cultures ×2. Possibly start the patient, after you get the blood culture, start the patient on some antibiotics. Use the sterile techniques to change the dressings. Okay, this is a picture of what the staff should look like when they're either assisting the physician in placing a catheter or when they're initiating and terminating dialysis treatment. Okay, so the evidence for change. Okay, so some of the things that I see around the hospital that makes this a necessary project and is to increase the knowledge among the patients and the staff. A lot of times the hospital staff will access the catheter and they won't have on a gown, they won't have on gloves, they won't have on a mask. And anytime that dialysis access is accessed, you should have on sterile gloves, gown, and mask. So these are some of the things here that just makes the project necessary. Okay, so as a dialysis nurse, what can we do to manage the care of these patients? Okay, so nursing assessment is one, diagnosing, plan, intervene, and evaluate. Okay, recommendations. Okay, you want to assess the skin for color, temperature, swelling, drainage, and pain. When it comes to diagnosing, you want to monitor the patient for ineffective protection of the access site. You want to monitor for knowledge deficit on the patient, for the patient, and any risk for infection. So we're going to plan. If you in planning, if you suspect that the patient have an infection, or if you see any signs and symptoms of an infection, and some of the things that I mentioned earlier, after you notify the physician, is he'll want you to draw labs, usually a CBC with differential, blood cultures ×2 from a different site. If you see any mucus drainage coming from the catheter exit site, you'll probably swab it with the cotton swab tips and culture it, and start the patient on a broad spectrum antibiotic. The other things that we can do to prevent this from happening is good hygiene, using sterile and proper technique for changing the dressing, teaching the patient, and this is an important one, is teaching the patient that the dialysis access should not be accessed by anyone other than a dialysis nurse or someone who has training to access that catheter. Okay, more recommendations. You're going to consider your patient and his medical diagnosis, whether it be contributed to development, and usually the patient diagnosis usually contribute to the development of infection. Again, we're going to draw labs, CBC with differentials, observe for signs and symptoms of infection, check vital signs Q4 hours, assess the patient personal hygiene, because as I mentioned in the earlier slide, that the bacteria on our skin, which is our normal flora, it can actually get into the catheter and cause infection. We're going to avoid getting the dressing wet, because if it stays wet, bacteria grow, and we're going to use maximum barrier precautions when changing the dressing, initiating and terminating the treatment, and again, only trained healthcare professionals should access the dialysis catheter. Okay, so evaluating this project, gathering information from admissions of the patients being admitted during. Okay, we're going to gather information from admissions on patients being admitted with a diagnosis of catheter infection. We're going to do quarterly evaluation of staff using proper technique and initiating and terminating treatment, changing dressings, and assessing catheters for medication use. Patient coming in for dialysis with no signs and symptoms of infections, and evaluate the patient knowledge level. Okay, so the expected outcome is we want to see a decreased number of catheter infections. We want to see increased knowledge for staff on using sterile precautions every time they initiate, terminate, and do dressing changes. We want to see during quarterly evaluations that they score greater than 80% on the written materials, and patients able to use the teach-back method on signs and symptoms of infection and decrease in hospitalizations and costs for the patients. Okay, in conclusion, the objective for this PowerPoint was to bring awareness to tunnel-related catheter infections among dialysis patients. The PowerPoint discussed several methods on preventions, such as teach-back method, proper training for nursing staff. The outcomes for this PowerPoint is that dialysis patients will benefit from the minimal, will benefit with the minimal to no infection, decrease in hospital stays and costs for both the hospital and patients.